What if I told you that something sitting in your medicine cabinet right now, something you've trusted for years, could quietly be putting extra strain on your heart, and you wouldn't feel it until it's too late? I'm not here to scare you, but I am here to make sure you don't miss what your body might already be trying to tell you. Before we go any further, if you care about your health and want clear, honest medical insights explained in a way that actually makes sense, take a moment to like this video and subscribe. It helps more people hear information that could genuinely protect them. Now, let me speak to you not just as a doctor, but as someone who has sat across from patients who were doing everything right and still ended up with unexpected heart complications. Most people don't realize that as we age, especially after 60, our bodies process medications very differently. The liver slows down, the kidneys become less efficient, blood vessels lose flexibility, and the heart becomes more sensitive to stress than it used to be. What I'm about to tell you might surprise you. Some of the most commonly used medications, ones prescribed every single day, ones you might even be taking right now, can place hidden pressure on your cardiovascular system when used long-term or without proper monitoring. I've seen this happen too many times. A patient comes in with fatigue, mild shortness of breath, maybe a bit of swelling in the legs. Nothing dramatic, nothing alarming at first glance. But when we look deeper, we often find a pattern. Medications that were meant to help one condition are quietly affecting the heart in ways no one noticed early on. And here's the part that concerns me most. These changes don't always come with loud warning signs. Sometimes it's just a little more tiredness than usual, a slightly irregular heartbeat, a feeling you brush off as just getting older. But your body is rarely silent without a reason. This isn't about telling you to stop your medications. That would be irresponsible. This is about awareness, understanding what questions to ask, what signs to watch for, and how to work with your doctor to protect your heart as you age. Because the truth is, your heart doesn't just keep you alive, it determines how well you live. And if there's even a small chance that something you're taking daily could be affecting it, wouldn't you want to know? Stay with me, because what we're about to uncover next might change the way you look at one of the most harmless medications people rely on every day. Let me tell you about something many people take without a second thought: pain relievers. You might recognize them as everyday medications, used for headaches, joint pain, back stiffness, or that lingering discomfort that seems to come with age. Names like ibuprofen or diclofenac are often seen as harmless, almost routine. But what I'm about to tell you might surprise you. These medications belong to a group called non-steroidal anti-inflammatory drugs, or NSAIDs. And while they can be effective for managing pain, especially in the short term, their long-term or frequent use, particularly after the age of 60, has been linked to increased strain on the heart. Most people don't realize how this happens. NSAIDs can cause the body to retain fluid. That might not sound like a big deal at first, but for your heart, it means more volume to pump, more pressure to manage, more work every single minute of the day. Over time, this added strain can contribute to elevated blood pressure and may increase the risk of heart-related complications in certain individuals. I've seen this happen too many times. A patient starts taking these medications regularly for knee pain or arthritis. At first, they feel relief. Life becomes easier, but slowly, almost invisibly, their blood pressure begins to creep up. They feel a bit more tired walking upstairs. Their ankles swell slightly by evening. It's subtle, easy to ignore. What I'm about to say is important. This doesn't mean these medications are bad or should never be used. In fact, when taken appropriately and under guidance, they can play a valuable role in managing pain and improving quality of life. But the key word here is awareness. If you find yourself relying on these medications frequently, daily, or almost daily, it may be worth having a conversation with your doctor. There may be alternative strategies, adjusted dosages, or additional monitoring that can help reduce potential risks while still keeping you comfortable. And here's something else many people overlook. Combining these medications with certain heart drugs or blood pressure medications can sometimes amplify their effects on the cardiovascular system. Your body is a delicate balance. Every pill you take interacts with that balance in ways that aren't always obvious at first. And as we get older, that balance becomes even more sensitive. So if you've been reaching for pain relievers more often lately, don't ignore that pattern. Your body might be asking for relief, but your heart may be asking for protection at the same time. And what I'm about to share next involves another medication category that many people depend on daily without realizing the quiet signals their heart could be sending in response. Now, let's talk about something millions of people rely on every single morning: medications for blood pressure. At first, this might sound confusing. After all, these drugs are prescribed to protect your heart, not harm it. And in many cases, they absolutely do. Medications like amlodipine or metoprolol have helped countless people reduce their risk of serious cardiovascular events. But here's what most people don't realize. Even medications designed to support heart health can create unexpected challenges, especially when doses are too high, combinations aren't closely monitored, or the body begins to respond differently with age. What I'm about to tell you might surprise you. As you get older, your nervous system becomes more sensitive to changes in blood pressure. That means medications that once worked perfectly for you can, over time, lower your blood pressure too much, especially at certain times of the day or night. I've seen this happen too many times. A patient comes in feeling dizzy when they stand up. They describe moments of lightheadedness, maybe even a brief blackout or a near fall. They assume it's just fatigue or dehydration or just getting older. But when we measure their blood pressure in different positions, lying down, sitting, standing, we sometimes uncover something important. It drops more than it should. This is known as orthostatic hypotension, a condition where blood pressure falls suddenly when you stand. And while it may sound mild, it can increase the risk of falls, injuries, and even place stress on the heart as it tries to compensate. Here's the part that often goes unnoticed. These symptoms can come and go. One day, you feel fine. The next, you feel slightly off balance. It's inconsistent, which makes it easy to ignore. But your body is trying to communicate. Another thing many people don't realize is that certain combinations of blood pressure medications can slow the heart rate more than intended. For some individuals, especially those already prone to fatigue or low energy, this can lead to a persistent feeling of weakness or reduced stamina. Again, this doesn't mean you should stop taking these medications. That could be dangerous. It means you should stay curious about how your body feels. If you've noticed subtle changes, dizziness when standing, unusual fatigue, or a sense that your energy isn't what it used to be, it's worth discussing with your doctor. Sometimes, a small adjustment can make a significant difference. Because the goal isn't just to control numbers on a chart. The goal is to support your heart in a way that helps you feel steady, strong, and fully present in your daily life. And what we're about to explore next involves a medication many people turn to for relief at night, not realizing how it might quietly influence their heart rhythm while they sleep. Let's talk about something many people depend on at night, something that promises rest, relief, and a break from the stress of the day: sleep aids. For some, it's an occasional tablet to help during a restless night. For others, it becomes part of a nightly routine. Medications like diphenhydramine, commonly found in over-the-counter sleep products, or prescription options like zolpidem are widely used, especially as sleep patterns change with age. And yes, sleep is essential, deeply essential. But what I'm about to tell you might surprise you. Some sleep medications can affect more than just your brain. They can influence your heart rhythm, your breathing patterns, and even how your body regulates oxygen while you sleep. I've seen this happen too many times. A patient tells me they finally feel like they're getting good sleep. They fall asleep faster, stay asleep longer. But during routine monitoring, we sometimes notice subtle irregularities, slight changes in heart rhythm or periods where breathing becomes shallow or uneven. These aren't always dramatic. They don't wake you up in the night. You don't feel them happening, but your body notices. Most people don't realize that certain sleep aids can have sedative effects that extend beyond what you feel consciously. They can relax not only your mind, but also muscles involved in breathing. For some individuals, especially those with underlying heart or lung conditions, this can place additional strain on the cardiovascular system over time. And then there's another layer. Some medications, particularly those with antihistamine properties, can cause next-day drowsiness, slower reaction times, and a lingering fog. That might seem like a minor inconvenience, but in reality, it can increase the risk of falls, reduce physical activity, and indirectly impact heart health by limiting movement and circulation. It's all connected. What I'm about to say is important. This doesn't mean sleep medications are unsafe for everyone. In certain situations, they can be helpful when used carefully and under proper guidance, but they are not always meant for long-term, nightly use without reassessment. If you've been relying on sleep aids regularly, it may be worth asking a simple question. Is this still the best option for me? Sometimes, improving sleep hygiene, adjusting timing, or exploring alternative approaches can reduce the need for medication while still helping you rest. Because real, restorative sleep isn't just about being unconscious. It's about allowing your heart, your brain, and your entire body to recover in a natural, balanced way. And what we're about to uncover next involves another category of medication that many people trust for emotional well-being, without realizing how closely the heart and mind are actually connected. Now, let's talk about something deeply personal. Medications used to support emotional well-being. This is an area where I want to be especially careful because these medications can be life-changing in a positive way. Drugs like sertraline or amitriptyline are commonly prescribed to help manage depression, anxiety, and other mood-related conditions. And for many people, they provide real, meaningful relief. But what I'm about to tell you might surprise you. The connection between your brain and your heart is stronger than most people realize. In fact, your heart rhythm is partly influenced by electrical signals and chemical messengers that are also affected by certain medications used for mental health. I've seen this happen too many times. A patient feels emotionally more stable, which is wonderful. But during routine evaluation, we notice subtle changes in heart rhythm. Not always dangerous, not always immediate, but present enough to deserve attention. Some medications, particularly older types like tricyclic antidepressants, may influence something called the QT interval, a measurement related to the heart's electrical cycle. When this interval becomes prolonged, it can, in certain cases, increase the risk of irregular heartbeats. Now, this doesn't happen to everyone, and with proper medical supervision, many people take these medications safely for years. But here's where awareness becomes important. Most people don't realize that the risk can increase when these medications are combined with others, especially certain antibiotics, antihistamines, or heart medications. It's not always about a single drug, but how multiple prescriptions interact inside your body. Your body doesn't separate medications into neat categories. It processes everything together. Another subtle signal I often ask patients about is a feeling of palpitations, like your heart is fluttering, skipping, or beating slightly out of rhythm. Sometimes it's brief, sometimes it only happens at rest, and often it's dismissed as anxiety or stress. But it's always worth paying attention, because your heart has its own language. What I'm about to say is important. If you're taking these medications, do not stop them suddenly. That can do more harm than good. Instead, if you notice changes, physical or emotional, Bring them into the conversation with your doctor. The goal is not to create fear, it's to create understanding. Because when your mental health and heart health are both supported in a balanced way, the results can be powerful. You feel clearer, stronger, more present in your life. And what we're about to explore next involves a medication many people take for something as simple as heartburn, without realizing how it might quietly influence nutrient levels that your heart depends on every single day. Now let's talk about something so common, so routine, that most people never question it. Medications for acid reflux and heartburn. You've probably seen or even taken drugs like omeprazole or pantoprazole. They're often prescribed for conditions like acid reflux, gastritis, or that burning sensation in the chest that can make eating uncomfortable. And when they work well. Relief can feel almost immediate. The discomfort fades. Meals become enjoyable again. Life feels normal. But what I'm about to tell you might surprise you. When these medications are used for extended periods, especially without regular review, they can begin to affect how your body absorbs certain essential nutrients. And some of those nutrients play a quiet but important role in how your heart functions. I've seen this happen too many times. A patient comes in feeling unusually fatigued, not dramatically ill, just not quite themselves. Maybe they've noticed muscle weakness, occasional cramps, or a sense that their energy isn't as steady as it used to be. At first glance, it doesn't seem connected to heart health, but when we look deeper, we sometimes find lower levels of magnesium or vitamin B12, nutrients that are important for nerve function, muscle contraction, and maintaining a stable heart rhythm. Most people don't realize that stomach acid isn't just there to cause discomfort. It actually helps your body absorb key vitamins and minerals from the food you eat. When acid levels are reduced for long periods, that absorption process can change. And over time, even small deficiencies can begin to affect how your body feels and functions. Now, this doesn't mean these medications are unsafe. In many cases, they are necessary and beneficial, especially for managing chronic conditions that could otherwise cause serious complications. But here's where awareness becomes essential. If you've been taking these medications for months or even years, it may be worth asking your doctor whether periodic monitoring of nutrient levels is appropriate. Sometimes, simple adjustments like reviewing dosage, timing, or supplementation can help maintain balance, because your body is constantly adapting, and what worked perfectly a year ago might need a small adjustment today. Another thing many people overlook is that symptoms like fatigue, irregular heartbeat, or muscle discomfort are often attributed to aging, when in reality they may have a more specific and manageable cause. Your body doesn't just slow down without reason, it responds to what it's given, and sometimes to what it's missing. And what we're about to discuss next ties everything together, because it's not just about individual medications, but the way multiple prescriptions can interact in ways that even experienced patients don't always anticipate. Now, I want to bring everything together, because the most important risk isn't always a single medication, it's the combination. What I'm about to tell you might surprise you. Many people over the age of 60 are taking 5, 6, sometimes even more medications every single day. Some are for blood pressure, others for pain, sleep, digestion, or emotional health. Each one prescribed with good intention, each one serving a purpose. But your body doesn't process them separately. It processes them all at once. I've seen this happen too many times. A patient comes in with vague symptoms, fatigue, dizziness, a sense that something just isn't right, nothing dramatic, no clear red flag. But when we review their medications carefully, we begin to see overlapping effects. 2 medications that both lower blood pressure slightly, now lowering it too much. 1 medication that affects heart rhythm, combined with another that subtly does the same. A drug that changes electrolyte balance, interacting with another that depends on those same electrolytes to keep your heartbeat steady. Individually, each one may be appropriate. Together, they can create a very different picture. This is what we call polypharmacy, the use of multiple medications at the same time. And while it's sometimes necessary, it requires careful, ongoing attention, especially as your body changes with age. Most people don't realize that even small changes, like adding a new prescription, increasing a dose, or even starting an over-the-counter supplement, can shift that balance. And here's the part that matters most. Your body often gives you early signals. A little more fatigue than usual, a bit of dizziness when you stand, a subtle flutter in your chest, slight swelling in your legs by the end of the day. These are not things to ignore. They are messages, not emergencies, but invitations to look closer. What I'm about to say is something I share with every patient I care for. Never assume that a symptom is just aging. Aging does not mean unexplained discomfort. It does not mean accepting changes without understanding them. You deserve clarity. You deserve to know what's happening inside your body. And sometimes the most powerful step you can take is a simple one: reviewing your medications with your doctor or pharmacist, asking questions, staying curious, making sure that every pill you take is still working for you, not quietly against you. Because your heart is incredibly resilient, but it's also incredibly responsive to what you put into your body every single day. The goal isn't to fear medications. It's to use them wisely, intentionally, and with awareness. And if this message stayed with you, even in a small way, then you've already taken an important step toward protecting something that matters more than anything else: your time, your energy, and the steady, reliable rhythm of your heart that carries you through every moment of your life.